Hello, Burleson County. Over the last couple of years, our crisis intervention team at the Burleson County Sheriff's Office has created a very strong partnership with our Burleson Health Resource Center. Whenever a crisis has arose and had a unique need, Albert and his team, they've always stepped up and been able to help provide guidance and support. Unfortunately, over the years, I have noticed that a lot of residents here in Burleson County don't know that we have a health resource center. I wanted to kind of help shed some light to let them kind of showcase what services they provide, what they're about, and how they've been able to help the community here recently. So, Albert, if you want to introduce yourself and kind of what your role here as the director of the BHRC is.
Sure. So I'm Albert Ramirez. I'm the executive director of the Burleson Health Resource Center. The Health Resource Center was established in 2004. Uh, we secured a grant of $1.5 million with the help of the Texas A&M School of Rural Public Health. That and a group of collaboration of nonprofit organizations and counties came together to uh, secure this funding to set up health resource centers in 4 counties. Here in Burleson County, we've had fantastic support from the key stakeholders from the hospital district, from Burleson County, uh, and we've been able to develop over the course of 22 years a program that I believe is serving the community very well.
I can attest to that. Um, so, what is your mission as the BHRC since its founding in '04, and kind of how has it evolved?
So in 2004, the mission remains relatively the same, but there have been some evolution of our work. The primary mission of the Health Resource Center is to enhance and improve the overall health of the community by improving access to services of Burleson County residents. And by access to services, we're talking about health related services in the general sense. When people hear the name Burleson Health Resource Center, sometimes they confuse the word health with sort of attending to medical needs. We're really working on attending to the broader health related needs of the community, of individuals, and of families. So we're talking about the kind of issues that are related to psychosocial well-being as well as physical health. So, maintaining a roof over one's head, having access to good food, having access to employment, having access to mental health services, addressing issues of domestic nature, addressing issues of the elderly and the vulnerable, addressing issues related to children and keeping them safe and healthy.
Absolutely. So, you personally, why did you choose the Health Resource Center and why Burleson County?
I got lucky. I got really lucky because I had been overseas for 14 years working in community development work in Southeast Asia and in the Balkans. I had no idea what I was going to be doing when I came back to Texas, but I found that um, a particular nonprofit, Project Unity, was looking to hire folks to help them set up these health resource centers. And I had essentially a choice between Madison and Grimes and Leon and Burleson, and I selected or got volunteered to come into Burleson County, and I believe that it was uh, necessary that we look at getting these health resource centers not just in Burleson County but into rural counties specifically. And it's not just these 4 rural counties. I believe that rural counties all across Texas and indeed all across the nation need help addressing the needs of their particular citizens. So, why Burleson County? Because folks in rural counties need improved access to services. Folks in urban areas have easy access to services. So, the issue that we have, though, is that money comes into Bryan College Station and it filters out to the rural areas through the agencies and programs that are clustered in Bryan College Station. We felt that it was really important to set up health resource centers to entice those agencies to have more of a presence in Burleson County. And that's kind of been our work over the course of the years, is to have a place in Burleson County where our partners who are clustered in Bryan College Station can come and meet with their folks and see people on a regular basis.
Speaking of partners, who are some of your key partners? How do those partners support your services?
So we have many, many partners. The approach that we take here at the Burleson Health Resource Center is that when a person or a family is in need, they will get referred to us, or they can come knock on our door, or they can give us a call. And that need could be related to, my kid is having a problem in school. His behavior is out of control. My father has Alzheimer's and I don't know what to do. I lost my job and I can't pay my rent. I am dealing with a substance use issue, and I've been arrested, and I'm gonna, I'm being told I need to get some help. The issue could be related to just about anything, and people will come to us, and we will sit down with them and ask all the questions that we need to ask to get a really good handle on what is the issue at hand, but also what might be some of the underlying issues and concerns that are contributing to that issue at hand, so that we can then take the next step of linking that individual and family to not just the issue, to not just programs that will address the issue at hand, but will help them to address the sort of some of the underlying issues as well. So we will develop a resource access plan that is sort of multifaceted and might involve multiple agencies to be involved. So that kind of approach, having case management at our core, forces us to develop the relationships with agencies throughout the region that are going to be partners with us in getting that help to folks. So it's really been a function of time through which we've been able to develop the relationships. We know who will answer the phone when we call. We know who we can trust to deliver on their promise. Just because an agency is out there doesn't mean necessarily they're our partners. We need to test that relationship. How well are they going to do for the folks that we're going to refer to them? Otherwise, we're not referring.
Yeah, I've seen over the years, we've definitely vetted quite a few programs.
Yeah.
The guys that answer the phone and the guys that don't.
Now, let me kind of go back to the mission. The mission being that we are trying to get help to people that need help. But as I said, our mission has kind of morphed over time, because we began to realize that we're not just serving the people that need help. We're serving other sectors of the community. We're serving the Burleson County Sheriff's Office. We're serving the schools. We're serving the hospital. We partner with all of y'all in order to reduce inappropriate use of the emergency room, for example, in order to keep people out of the county jail who don't need to be in the county jail but need some mental health services, or need substance abuse counseling, or need other services that will hopefully prevent the behaviors that we're seeing that bring them into the jails. And the schools need our help. The schools are saying, what do we do with this family and this child that are needing help? We need to get some help to these individuals. So our approach began to shift as we began to understand we need to be not just serving the individual, the client, the family, but be there for our partners that are saying, hey, we need your help. So essentially kind of becoming the hub of coordination among agencies to kind of bring together the agencies in a multi-sectoral interagency plan of how do we get help to these families. There is a function called the Community Resource Coordination Group, CRCG. It was mandated in 1987 by the state of Texas that every county have a CRCG, the purpose of which is to bring agencies together, state-funded agencies, nonprofits, local agencies, local government, schools, sheriff's office, mental health providers, bring folks together, because no one agency can do it by themselves, but bring folks together to develop those plans to deal with difficult cases, and any partner can bring a case to the CRCG and say, "Hey, I need some help with this." Um, what has happened here in Burleson County is because we have the approach that we have basically institutionalized the CRCG function, and it's made it sort of a natural fit for the CRCG to chair, for the Burleson Health Resource Center to chair the CRCG. And so we've served as the chair of the CRCG since 2006 or so, I believe. And through the course of time, we have developed, because of the nature of our work, a very strong community resource coordination group. We just had our meeting here in February. We had like 80 people in the room.
It was a pretty full room.
People from put a pretty full room, and again, that's representatives of agencies from all over the region. And we had representatives from all of our school districts, or at least I believe we had all of our school districts. At least two of our districts were in attendance, and we had we invite our justices of the peace, our county government folks, our county court system, our churches, and then of course our service providers. And the idea being that everybody gets an opportunity to share their information, to gain information, and to develop a network of partnership that works across the region. So not just here in Burleson County, we have to partner with folks outside the region to get those services in. And so it's a very strong vehicle, forum for developing those partnerships and identifying who can we work with. So that's just another way that we do it.
So how would an individual get access to these services? Is there any eligibility requirements to come to the BHRC?
Are you a resident of Burleson County? Start there. If you're a resident of Burleson County and you have an issue and you just need some guidance or you need to be connected, give us a call. Now, there's nothing that makes, we as the Health Resource Center, we're not saying you have to be, of a certain income level, or that you have to have a certain status. We want you. We are here to serve Burleson County residents. But if you're living here in Burleson County, we're going to do what we can to get you linked to the help you need. So give us a call, make an appointment to see one of our case managers, and let's have a sit down and get a good handle on what the issue of concern is.
Do you guys have any potential services that y'all are planning on putting together in the future for community needs?
Yes. So let me first describe what we have been along the way. We've been a primarily case management. We use a case management approach to deal with assessing the needs and developing a resource access plan for our individuals and families that need help. We also have needed and have developed a transportation program. We started with one minivan in 2004 and a volunteer driver. And now we have 4 vehicles, 2 of which are wheelchair accessible, 2 SUVs. We have 4 drivers that are paid, not volunteers, because we had a really hard time working with the volunteer team to get this done. And those folks get our people that do not have transportation, that maybe they have transportation, but they can't drive because they're elderly or sick, or they're going to cancer treatments, or they're going to dialysis. And they need help getting to medical and social service appointments. So we've developed a very strong transportation program. I think it's one of the strongest in the region in terms of serving that particular group. Unfortunately, we can't get people to work and back. We can't get people to school and back. We're not a public service transportation program. We're not an Uber program, but we can help the most vulnerable folks in the community to get to their social service and medical appointments, which is necessary. Mm-hmm. We also began to see the need early on that folks were needing help with addressing substance use concerns. And it took us until 2020 to bring in, finally, our own licensed chemical dependency counselor. And we have been developing over the course of time a substance use counseling program that is primarily dealing with folks that are being referred from the court system We get a few referrals from CPS and as well as just from our own case managers of folks that are saying, I need help, or I want help, or I must get help. And, and we, through that work, have begun also working very closely with the schools. We have developed what's called the Healthy Living Program, and the Healthy Living Program is an effort that brings together various partners: the Burleson Health Resource Center, the Brazos Valley Coalition on Suicide Prevention, the Scotty's House, Cedar Crest, BV Brazos Valley Council on Alcohol and Substance Abuse, and the Twin City Missions SMART program. And all of those agencies have within their mandate some calling to talk to students, to get messages to students that are going to help them minimize risk behaviors and educate them on the dangers of various behaviors.
Mm-hmm.
So we're providing information on not just substance use and its issues and the problems with substance use to try to prevent that, but also issues related to the cyber technology, texting, sexting, healthy relationships, child abuse, suicide prevention, and the schools also are welcoming of us being in there and providing that kind of education and information to students. So we're working closely right now with the Caldwell Independent School District, Somerville Independent School District, and it's going well. We hope that the Snook Independent School District will be engaging with us in that effort in the near future as well. So that is an important piece of what we're doing because it has been very important to us, and I think it's important to folks throughout the region, throughout the state, that we start looking more closely at the kids, teens, preteens. We're seeing kids 11 years old now
Mm-hmm.
that are dealing with issues, very, very difficult issues related to the intersection of substance use, mental health, not always by the kids. So we're talking about kids coming out of families that are dealing with multiple concerns. So those concerns are often manifested with behaviors that are challenging for schools and for communities to address. So we're seeing, like I said, we're seeing a lot of kids coming out. We're seeing a lot of young people coming into the criminal justice system as a result of those behaviors. And how can we start taking steps to minimize those kids coming into the criminal justice system at such a young age? One of the things that we're looking at, for example, is vaping. It's one thing to get caught with a vape at age 13, and let's say it's nicotine.
Mm-hmm.
It's another thing to get caught with a vape that's THC. That results in a felony charge. If we can get some of those kids turned around at age 12, 13 years old, start going in and talking with them about, and their parents, and this is where we've developed what's called the juvenile, we call it the JDAP, Juvenile Drug and Alcohol Program. Kids that get those kind of charges are referred to our program, sit down with our LCDC. We also have their parents involved, so that we're working with the parent and the child on education and prevention. And if they can successfully work a program with us, I think it's a 10 or 12-hour program of education, then the court system can work with the family on possibly reducing the charge or dropping the charge, taking that felony off the record of that child and giving that child an opportunity to turn it around.
Right.
Okay. And rather than having to carry a felony into his adulthood. So his or her adulthood. So, so we look at that as a key part of our work moving forward. We're really wanting to build out a part of our program that is going to enable us to work more closely with parents and children and students around the issues related to the kind of things that I've just talked about. Can we get people on staff that are able to talk with parents about effective parenting and have some skills in able to teach
Mhm.
effective parenting? Can we bring in people that are trained to deal with anger management among teens and adults? Because we're seeing a lot of issues in relation to how families relate to each other and how they take out their feelings of frustration and anger on those around them, causing more issues,
Right.
for everybody. So can we get some folks that are trained up in providing some guidance on how to better manage impulses? Can we get some folks that have lived experience in addiction, that are clean and sober and ready to commit themselves to helping others that are struggling with addiction? A peer recovery support system, a peer recovery support role. Can we get some folks that are adept at working with those kind of folks? Can we get folks on our team that are adept at working with the needs of the elderly? We're beginning to see many more issues in relation to um, an aging population, folks that are aging with minimal family support, with minimal resources, living in very difficult conditions, and increasingly unable to access the care they need. They can't drive, they don't have support, they're sickly, um, they're having difficulty just keeping a roof over their head. They need guidance and support moving from a very difficult living situation into a situation where they can live lives of dignity in in their waning years. Now, sometimes that might mean transition to a nursing home. Sometimes it might mean transition to an assisted living facility. Sometimes it might mean just transition to a from the country where you're
Yeah.
living in an RV that's falling apart around you to an apartment that is subsidized, and that you're living with people your age and people that can check on you, and you're connected to us, you're connected to services, and
Absolutely.
you're not going to be alone. And let me just make a point on that as well. I think a lot of folks that we're dealing with um, are just needing to know that there's connection, that they're connected, they're not isolated, that before they contacted us, they didn't know who to contact. Now they contact us, they're connected to resources and services, and they're not going to be alone again. They're going to have somebody that's aware of their situation and offering guidance. Okay, and so that's part of the benefit, I think, of the approach that we've taken here is that we work with folks over the long haul. We work with families over the long haul. We recognize that you know some problems, yes, we can get folks to address those problems and sort of graduate to self-reliance and uh, and sustainability. Other problems are just going to be with us for the long haul, and we need to work with those folks over the long haul and their families. So, that's part of our approach, is sort of recognizing that as well.
I think that is the best way to sum this up. Um, Other than that, is there anything else that the community needs to know that you want to make sure that's out there for people to hear? Or
There's a whole lot. I could talk for a long time about the Health Resource Center and what we do. I would say this: know that you're very lucky to be living in Burleson County. Um, this is a fine community of good-hearted, compassionate people that have taken on the support for what it is we're doing, and I believe that what we're doing is unique um, among counties in Texas. This is a model for how rural counties should be taking care of their people, and I think that Burleson County should be proud of what they have accomplished here with the Health Resource Center. And it's really after 22 years, really we're 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 just
set
I want to say
apart.
we're just getting started. We're just getting started. I think that there are opportunities now as we move forward. We have a very strong foundation. It's beyond a foundation. We have the structure. Now it's time to sort of take it to the next level, and I look forward to what the next 20 years holds for Burleson County.
Um, well, Albert, coming from the sheriff's office, we want to give you a massive thank you for what you and your team do here. I can tell you, as far as the crisis team is related, or as far as crisis goes, you you are a massive part of what we do. Like I said, when we have a unique problem, you're usually my very first phone call, and if you don't have an answer, and within 10 minutes you have an answer for me. So we thank you from that. Thank you to the citizens of Burleson County and for everything that you do for them. And that's pretty much all I have for you.
Well, it's been good spending time with you, Randy.
Well, I appreciate
Thank
your time. Real quick, can you introduce your team members?
Yeah.
Just list off their names.
So we have two offices. We have an office in Caldwell and an office in Somerville. Here in Caldwell, we have a case manager, Bertha Ostegine. She's not just a case manager; she handles our bookkeeping and she's fantastic. Licensed chemical dependency counselor Diane Gradington. We have our front desk person and peer support specialist Danielle Abdul Hamid. We have our transportation coordinator and our she's a transportation coordinator / community health worker. So we're kind of developing that community health work component. Amy Hildebrand. Amy coordinates among 4 drivers. We have in Somerville, we have Jody. Jody Olive is our case manager. Barbara Vincent is our office manager, also manages the Rainbow Room. One of the things I didn't talk about is our very close work with the Child Protection Board here in Burleson County. And then we also have Sean Edwards, who's just joined the team. Sean, formerly with the Sheriff's Office, heading up the Crisis Intervention team over there. He is taking over my job, and I will be leaving in the end of the summer. And I'm looking forward to the kind of things Sean is going to be able to do.
Absolutely. He and I both have some pretty big shoes to fill. So me and his and yours.
Yeah.
There we go. All right. Well, thank you so much. And that'll wrap this up. Thank you, Burleson County.
Thank you.
That was